New tonight, Block Island is doing something unique in its work to stop the spread of coronavirus. It's testing wastewater for the presence of COVID-19. Eyewitness News reporter Kim Kalunian spoke with the wastewater manager there, as well as state health and environmental officials about this new technology and if it could be coming to your community. Kim?
Well, you probably don't spend a lot of time thinking about what you flush, but researchers believe our waste might be able to predict future spikes in COVID-19. And now state officials are mulling the best ways to use this new type of testing.
This is the test that was taken today.
Block Island's water pollution control superintendent says the town's wastewater first tested positive for COVID-19 in early July.
It was shocking. When I saw that there was an estimation of 10 cases, it's all of a sudden like you hear about COVID-19, you don't see it, but now here it is. It's at your back door. It's kind of like seeing Bigfoot.
Dylan Chase says the island began testing its sewage for the virus back in May, working with Massachusetts-based company BioBot to try and identify if people with the virus, even those who are asymptomatic, are spending time on the island.
But the best case scenario is using this as a canary in the coal mine.
Angelo Liberti is the administrator of surface water protection with the Rhode Island DEM. He says they're in talks with the Department of Health and 4 of the state's larger wastewater treatment plants to determine if and how they'd roll out this type of testing statewide. He says research so far has shown that sewage could help predict future spikes in the virus.
The inactive virus in the wastewater samples seem to track cases of infection that occur 4 to 7 days after those wastewater samples. So a challenge there is that it takes that long to get the results back. And so there was some conversation about, well, how useful is it if by the time you get it back, it's no longer predicting?
It's just one of many unanswered questions about how to best use this testing and the data it yields. Chase says right now it boils down to the difference between precision and accuracy.
At this point, we cannot precisely state how many people have COVID-19 on the island, but I can accurately state that it is here.
And some good news. Researchers say untreated wastewater is not infectious. So even if it leaches into another body of water before it reaches a facility where it's sanitized, scientists say there's no indication you can catch coronavirus that way. I'm Kim Kalunian, Eyewitness News.